Our next condition is tennis elbow, and this is sometimes called lateral epicondylitis. And this is pain along the lateral portion of the elbow that can sometimes radiate down the forearm. The symptoms here are very localized. So it's the lateral portion of the elbow. So if the palm is placed forwards or the palm is facing forwards, it is the portion of the elbow which is lateral or furthest from the midline of the body. So it's the outside portion of the elbow which is affected. The pain can sometimes radiate down towards the hand, but it's usually pretty much localized right here at the elbow and at the forearm as well. Most people who I see who come in with this can point to this type of pain with one finger. The pain is often dull and it usually comes and goes. So it's not something that your client will have all the time. They won't, necessarily wake up with it or go to bed with it. And sometimes people can't really even pinpoint when the pain or what makes the pain come and go, but they just know that sometimes it's there, sometimes it's not, sometimes it's excruciating, and more often than not, it's just really dull and achy right in this area. This type of pain is worse with dorsiflexion of the hand, so this motion here where you're moving the dorsal aspect of the palm towards the portion of the forearm here, so this will make this worse. Supination of the hand, where you're bringing the hand up, also triggers this type of pain, as well as any type of lateral flexion of the wrist. And this is where we get this name tennis elbow, because holding a racket puts the wrist into lateral flexion, so that's going to trigger this type of pain. But more often than not, your client may not even play tennis or racket sports. It can just be just as simple as like shaking hands will also trigger this type of pain here as well. The cause of tennis elbow lateral epicondylitis, this is usually from overuse. So it can be overuse in terms of a sports injury, but I also see people who are not athletes, who are not racket sport athletes, who have this type of pain as well. And this can be from occupational overuse. So sometimes too much time spent in front of a computer, or the way that the hand is positioned during job tasks can also cause this type of pain as well. Lateral epicondylitis usually affects the dominant side because it's the dominant hand, which is always the one kind of going for the task and doing the task. So you usually see this if someone's right-handed, you'll usually see it on the right elbow. The traditional diagnosis here is strain of the local area, which causes a deficiency of qi and blood in the collaterals. In terms of the anatomy of the elbow is composed of 3 bones. So we have the humerus, which is the big bone in the upper arm, the radius, and the ulna, and these are the 2 bones in the lower arm. There are bony bumps at the bottom of the radius. So if you place your index and your thumb around the bottom of the radius, your thumb and your index finger will go right into these bony bumps. And this is called the condyles of the humerus here. So this is the outside edges of the humerus, and this is where the radius and the ulna fit into the humerus. And we're dealing with the lateral portion here, and this is where several tendons originate. In fact, this is where the major extensor tendons of the forearm originate. So anytime that the hand is put into extension, we're working with these tendons which originate right here from the lateral condyle of the humerus. One tendon in particular tends to be the culprit for lateral epicondylitis, and this is called the common extensor tendon. And this tendon originates right here at the lateral condyle of the humerus, and it goes down into the arm and it branches into the 5 extensor tendons of the arm and of the hand. So this is why anytime there's movement of the hand or of the wrist, it tends to put pressure and strain right here on this part of the elbow, and that is why the pain is often triggered right here, not necessarily down at the hand or the wrist. Overuse in this area can start to degenerate the hyaline cartilage, which covers this condyle of the humerus. So this joint is covered by this really thin layer of very nice, smooth cartilage called hyaline cartilage. And this cartilage over time, if this tendon starts to rub on it long enough, can have micro tears or degeneration in it, which can cause injury or irritation of this extensor tendon. And then also sometimes this extensor tendon can get little micro tears in it, which can also trigger this type of pain condition as well. I'll now show you the application of acupuncture for tennis elbow. So locate the lateral epicondyle of the elbow, and you'll find it's the bony prominence just directly on the outside of the elbow. And most people, this is a really nice bony prominence. In someone who does have tennis elbow, the common extensor tendon directly distal to this prominence is going to be nice and tender and sore. So we're going to place our local needles really close to this epicondyle and in a way that's helping to flush more fresh qi and blood and dispel stagnation in this common extensor tendon. So the first needle I'll show you is pretty much directly over the condyle, this lateral condyle here. So you're going to place the needle and have a transverse insertion. Tennis elbow is one of those cases where acupuncture actually might make it feel worse for a couple of days. So it's not uncommon that if someone gets a needle directly into this common extensor tendon, that they may feel a little bit more pain, a little bit more aggravation of the condition for 24 to 48 hours after the treatment. So it's always nice to set your client's expectation for that. But then after that initial period of 24 to 48 hours, that initial idea of more inflammation, more pain should really dissipate, and then your client should start to feel a lot of relief. So you're going directly over the condyle here and just right into that common extensor tendon. And I was able to place the needle about 1 inch in there. You just want to kind of graze over the needle. So I'm in between the space between on the top of the tendon, and I'm directly underneath the skin. So I'm not in the tendon. You're not needling directly down into that tendon. The second needle that you can place here, you're going to go about 1 inch to 1.5 inches distal to that lateral condyle. And again, this is going to be the same placement. You're just going to go transversely towards the wrist. So being really cautious with your needling, not going down into that tendon, just barely grazing above the surface of the tendon. And again, you'll get that nice point where you feel the chi with the needle, and both of these needles are placed appropriately to help dispel that stagnation right above that common extensor tendon. For distal points for tennis elbow, we're going to go back to that same concept of imaging. So we are trying to find points on the body that are homologous or an analogous structure to the elbow. So in that case, we can go to the knee. In Chinese medicine, the knees and the elbows are considered to be homologous structures. So we can image the elbow onto the knee. And this is a really nice advanced concept, so it's a good one to really wrap your head around, and you'll use this a lot when it comes to trying to find distal points on the body that help you to image another structure that you're trying to treat. In terms of the knee, we'll look for the lateral condyle of the femur because that images the lateral condyle of the elbow. So you'll find that on the lateral portion of the knee right here. You can find that lateral condyle. It's a nice bony prominence. And then you're just going to go into the depression anterior to that condyle. So this is a nice depression right here. It's not a deep depression, so you don't need to do a really deep insertion of the needle. And you just place the needle directly into that depression. And the depression is about 1/4 to 1/2 inch, just depending on your client's anatomy. So this is a really nice way to also help to send fresh chi and blood to the lateral portion of the elbow. And with these, you can use either side. You can use the affected side or the same side. Like I've mentioned before, I find it's a little bit more successful to use the opposite side in chronic conditions and then the same side in acute conditions, but everyone is different. So you really want to make sure that you expand your skill set by trying both sides with your clients and maybe seeing which side you get a little bit more traction with. I'll also show you some distal points here on the arm that you can use for tennis elbow. So this one you can locate on the opposite elbow. So let's say, for example, that this was the affected elbow of my client. I would go to the opposite elbow, and then I would find where the elbow crease ends. And it's a really clear drop off. There's no more elbow crease. And this is really into the musculature, the soft tissue of the elbow. And you just want to drop about 1.5 inch needle. This is a 36 gauge needle directly into this spot. And make sure you get a nice chi sensation. And make sure that you're doing this on the opposite side. Don't do this on the affected side. You really just want to use the techniques I taught you for just going directly over that common extensor tendon. So this would be an opposite side, directly at the end of the elbow crease, and this is on the large intestine meridian. You can also find another point on the large intestine meridian, and this is on the hand, and this is between the first and the second metacarpal. And this point is absolutely contraindicated in pregnancy. So again, be really cautious about screening your client. And this is a nice, fleshy, really innervated area. So it's really common that your clients will feel a strong chi sensation here, and that's perfectly normal. That's what we want in terms of trying to dispel that stagnant chi and blood that's just hanging out in the elbow. So you'll find your target here between the first and the second metacarpal. And this is a nice fleshy space. And just insert the needle. And again, be cognizant that this is a nervy area, so just go slow. And I like to do about 1/2 inch sensation here is where I'm feeling the chi. So this is placed appropriately. The third distal point I'll show you is on the triple burner meridian, and this is about 4 inches above the wrist crease. So you'll find the crease of the wrist, and you go 4 inches above it, and it's exactly between the ulna and the radius. So there's a nice depression here between the two bones, and you just want to do a perpendicular insertion directly into this triple burner space right here. And again, making sure that you get a nice chi sensation with all 3 of these needles. With these 2 right here, you can use them on the opposite side, but for sure with this point here on the elbow on the large intestine meridian, make sure that you do absolutely always on the opposite side.